All right. So you sent over this article
Okay.
from Rolling Hills Recovery Center,
Mm-hmm.
and it's all about medical detox.
Yeah.
And I got to say, it's a really good one. Let's break it down. See what
Yeah.
jumps out at us.
It seems like they put together a really thorough guide.
Exactly. And they get right to the point, too,
Mm.
starting with, like,
Yeah.
what medical detox actually is.
Right.
We hear the term all the time.
We do
But,
that.
like,
Yeah.
what does it really mean in practice?
Well, the article emphasizes that.
Okay.
It's not just about, like,
Yeah.
helping your body get rid of harmful substances.
Okay.
It's a very
Got it.
carefully structured process
Right.
where a medical team provides 247 support
Yeah.
to make sure you're as safe and comfortable as possible during withdrawal.
That makes sense. But, like,
Yeah.
why is that so important? Couldn't someone just
Yeah.
stop using on their own?
You could.
Yeah.
But quitting cold turkey,
Right.
especially for certain substances. Yeah.
Can be extremely risky.
Okay.
Imagine your body's been relying on a substance
Right.
for so long.
Yeah.
It's like a shock to the system when it's suddenly just
Oh, yeah.
gone.
Yeah.
Withdrawal symptoms can be intense
Yeah.
and in some cases even dangerous.
Like what kinds of danger? The article mentioned delirium tremens.
Right.
Honestly, that sounds terrifying.
It can be.
Yeah.
Delirium tremens, or DTs,
Yeah.
is a severe complication
Wow.
of alcohol withdrawal
Okay.
that can involve hallucinations,
Mm.
seizures,
Mm-hmm.
and in some cases even be fatal.
Gosh.
That's why medical supervision is so crucial,
Right?
having trained professionals there
Yeah.
to monitor your symptoms
Yeah.
and intervene if necessary can truly be life-saving.
I had no idea it could be that serious.
Yeah.
So medical detox provides that safety net,
Yeah, that's
but the article also mentions some other
Yes.
key benefits, right?
exactly.
Okay.
It breaks down 5 main benefits.
Okay.
Safe withdrawal.
Medical supervision.
Yeah.
Medication management.
Okay.
Psychological support, and this
Mhm.
one's really important.
Yeah.
Improved long-term recovery outcomes.
Okay, let's unpack those a bit.
Okay.
We've already touched on safe withdrawal,
Right.
but how does medical supervision,
Okay.
like, specifically benefit
Yeah.
someone going through detox?
It's about constant monitoring
Okay,
and personalized care.
got it.
Think of it like this.
Okay.
During medical detox,
Yeah.
you've got a whole team of healthcare professionals
You're right.
dedicated to ensuring your well-being.
Right.
They're monitoring your vital signs,
Mm-hmm.
managing any discomfort or complications,
Okay.
and adjusting medications as needed.
Yeah.
It's like having a 247 support system
Oh, well.
right there with you.
So it's not just about making withdrawal less miserable.
Right.
It's about making sure
Right.
you're safe throughout the entire
Yeah,
process.
absolutely.
Got it.
And it goes beyond the physical, too.
Okay.
Withdrawal can take a huge toll.
Yeah.
Mentally and emotionally.
That-
That's where psychological support comes in.
That makes sense.
Right.
The article mentions that medical detox programs often incorporate therapy
Yeah,
and counseling.
they do.
Right.
Exactly. It's
Right.
all about addressing the root causes of addiction
Mhm.
and developing healthier coping mechanisms.
Right.
During detox, you might participate
Okay.
in individual therapy sessions,
Mm.
group therapy,
Yeah.
or cognitive behavioral therapy,
Okay.
which helps you identify and change negative thought patterns.
It's about supporting you on multiple levels,
Mm,
physically,
right.
mentally,
Yeah,
and
that-
emotionally.
You got it.
Okay.
And that comprehensive approach can make a huge difference
Yeah.
in your long-term recovery.
Let's talk about medication management for a
Okay.
second.
Okay.
The article mentions that medications can help
Yeah.
ease withdrawal symptoms and cravings.
Mm-hmm.
How does that work?
Well, medications can help to minimize
Okay.
the intensity of those withdrawal symptoms,
Okay.
which can make the process much more manageable.
Got it.
For example,
Yeah.
for someone detoxing from alcohol,
Okay.
medications like benzodiazepines can help
Mhm.
reduce anxiety and prevent seizures,
Right.
which can be a real risk
Oh, yeah.
during alcohol withdrawal.
Okay.
For opioid withdrawal,
Uh-huh.
medications like methadone or buprenorphine
Yeah.
can help reduce cravings and block the euphoric effects
Wow.
of opioids.
Okay.
It's all about finding the right tool for the job,
Okay.
so to speak.
So it's not just about,
Mm-hmm.
like, toughing it out. Medication can actually
Mhm.
play a vital role
It can.
in making the process
Yes,
safer and more manageable.
exactly.
Right.
And again, it's important to emphasize
Yeah.
that these medications are carefully selected
Yeah.
and administered by the medical team
Okay.
to ensure safety and effectiveness.
Right.
They're a crucial tool in supporting your body through this challenging process.
This all makes a lot of sense. The article also outlines
Yeah.
what someone can actually expect
Okay.
during the medical detox process.
Right.
And it breaks it down into like 4 main stages:
Mm-hmm.
evaluation and assessment,
Yeah.
medication management,
Yeah.
therapeutic support,
Uh-huh.
and monitoring and supervision.
Yeah.
It sounds like a very structured approach.
It is.
Okay.
The first stage evaluation and assessment
Right.
is all about gathering information.
Okay.
The medical team will conduct a thorough assessment
Mhm.
to understand your medical history,
Okay.
substance use patterns,
Yeah.
mental health status,
Got it.
and any other relevant factors.
So it's about getting the full picture
Yeah.
before creating a plan.
Right. It's about understanding your individual needs
Okay.
and challenges to tailor a detox plan
Yeah.
that's both safe and effective for you.
Okay.
It's like really making sure that the detox plan is as personalized as possible.
Okay.
So they'll ask about like your
Yeah.
past and present medical conditions, any
Okay.
medications you're taking,
Mhm.
the specifics of your substance use,
Okay.
how often, which substances,
Right.
and
Yeah.
whether you've experienced withdrawal symptoms before.
Okay.
It's very thorough.
Wow. That's a lot to cover.
Yeah.
I imagine that can feel
Yeah.
a bit overwhelming
Right.
for someone who's already
Yeah.
feeling vulnerable.
Right. It is a sensitive time,
Yeah.
but it's all about
Okay.
getting the right information.
Right.
So the medical team can provide the best possible care.
Okay.
They might also
Yeah.
conduct a physical exam
Okay.
and order some lab tests
Mhm.
just to make sure they have a complete understanding of your health
Right.
going into the process.
Okay. That makes sense.
Mhm.
So once they have all that information,
Right.
what happens next?
That's when the journey moves into the second stage,
Okay.
medication management.
Medication
We
management.
touched on this a bit earlier.
Yeah, we did.
But essentially, this is where the team
Yeah.
uses medications
Right.
to manage those difficult withdrawal symptoms
Yeah.
and try to minimize
Okay.
any discomfort.
And the article pointed out
Yes,
that different substances require different medications.
absolutely.
Right.
For someone detoxing from alcohol,
Okay.
they might use benzodiazepines,
Uh-huh.
which can help reduce anxiety and prevent seizures,
Okay.
which we've said can be a real risk
Right.
during alcohol withdrawal.
Yeah.
For opioid withdrawal,
Okay.
medications like methadone or buprenorphine
Right.
can help reduce cravings and block those euphoric effects
Okay.
that opioids have.
Okay.
It's all about
Right.
finding the right tool for the job,
Right.
so to speak.
So it's not just about toughing it out.
Right.
Medication can actually play like a vital role
It can.
in making the process.
Safer and more manageable.
Exactly.
Okay.
And again, it's important to remember that these medications are carefully selected and monitored
But,
by the medical team
right.
to ensure that they're being used safely
Yeah.
and effectively.
Okay.
They're there to guide you
Right.
every step of the way.
Right. That's really reassuring.
Yeah.
And what about the
Yeah.
psychological aspect
Yeah.
of detox?
Yeah.
We talked about the importance of therapy, but
Yeah.
how does that fit into
Oh,
the
yeah.
overall process?
That's the third stage,
Oh.
therapeutic support.
Therapeutic support.
As we said, withdrawal isn't just a physical process.
Mhm.
It's emotional and mental, too. It can dredge up
Right.
a lot of difficult feelings.
Yeah.
Anxiety,
Uh,
depression,
yeah.
irritability,
Okay.
and those intense cravings we talked about.
Right. I can only imagine. So therapy helps people process those emotions
Yeah.
in a healthy way.
Yes. And it helps them.
Develop those critical coping mechanisms
Ready.
they'll need for long-term recovery.
Okay.
Think of it like building a toolbox.
Yeah.
Therapy helps you fill that toolbox
Mm-hmm.
with tools that will be useful
Yeah.
long after the detox process is over.
I love that analogy. What kind of tools are we talking about here?
Well, it depends on the individual and their needs.
Okay.
But some common therapeutic approaches
Yeah.
during detox include
Okay.
individual therapy,
Hmm.
where you can work one-on-one with a therapist
Okay.
to explore your personal challenges.
Got it.
Group therapy,
Yeah.
where you can connect with others who
Mhm.
are going through similar experiences,
Mm-hmm.
and cognitive behavioral therapy,
Okay.
or CBT,
TDT.
which helps you identify and change negative thought patterns
Right.
that might be contributing to your substance use.
So it's about
Yeah,
equipping you with the skills
right.
and strategies you need
Mm,
to navigate those challenging emotions and situations
right.
that might
Yeah.
trigger cravings or relapse
Yeah.
down the line.
It's about giving you the best chance of success
Yeah,
in your recovery journey.
that makes a lot of sense.
Yeah.
Now, the article also mentions
Yeah.
monitoring and supervision
Okay.
as like a key part
Right.
of medical detox.
Mm-hmm.
What does that entail?
That's the fourth and final stage.
Yeah.
And it's all about ensuring your safety and well-being
Okay.
throughout the entire detox process.
Got it.
The medical team is constantly monitoring your vital signs,
Okay.
observing your behavior,
Right.
talking to you about how you're feeling.
Mm-hmm.
They're making sure that everything is progressing as it should be
Right.
and that you're getting the support you need.
So it's like having a watchful eye on you
Yeah,
around the clock.
exactly.
Yeah.
They're there to catch any potential complications early on
Okay.
and adjust your treatment plan as needed.
Okay.
They're your safety net,
Mm-hmm.
your advocates,
Yeah.
your guides
Okay.
through this challenging terrain.
That's so important. It really underscores the value
It does.
of having that medical expertise and support
Yeah,
available throughout the entire detox process.
absolutely.
Now, you mentioned that detox typically lasts a few days to a couple weeks.
Right.
But the article points out
Yeah.
that the duration can vary
Yes, it can.
quite a bit.
Yeah.
What are some of the factors that influence
Okay.
how long someone needs to be
Yeah.
in detox?
Well, the biggest factor is the substance itself. Like
Okay.
withdrawal from some substances.
Yeah.
Like alcohol
Okay.
tends to have a shorter duration than others, like
Right.
opioids.
Okay.
The severity of the addiction is also a factor.
Okay.
Someone who's been using heavily
Right.
for a long time
Yeah.
may need a longer detox period
Okay.
than someone who's been using less frequently.
Right.
And then, of course, everyone's individual physiology is
Right. So
different.
age,
Yeah,
overall health, things like that could also play a role.
exactly. And it's not just about physical health either.
Right.
Mental health conditions
Okay.
can sometimes complicate the detox process and necessitate a longer stay.
Got it.
It's truly a personalized journey,
Right.
and the medical team will work with you
Yeah.
to determine the appropriate length of time
Okay.
based on your unique needs and circumstances.
That makes a lot of sense. It's
Yeah.
not a one-size-fits-all approach.
It's not.
And speaking of individual needs,
Yeah.
the article also talks about
Okay.
the potential risks and side effects
Right.
associated with medical detox.
Mm-hmm.
It acknowledges
Yeah.
that
Yeah.
even with medical supervision,
Yeah.
things can still be tough,
Again.
especially for substances
Mm-hmm.
like alcohol,
Yeah.
benzodiazepines,
Right.
and opioids.
Yes.
Yeah.
Those substances in particular
Ah.
tend to have more intense and potentially dangerous withdrawal symptoms.
Right.
For example, we've talked about
Yeah.
delirium tremens or DTs
Yeah.
in alcohol withdrawal,
Uh-huh.
which can be life-threatening.
Right.
And benzodiazepine withdrawal can also be quite challenging with
Sure.
symptoms like
Right.
anxiety,
Yeah.
panic attacks,
Yeah.
tremors,
Okay.
and even seizures.
Wow. That's a lot to handle.
Yeah.
And what about opioid withdrawal?
Okay.
What kinds of challenges are
Yeah.
associated with that?
Opioid withdrawal is often described
Okay.
as incredibly uncomfortable,
Okay.
although it's not typically life-threatening
Right.
unless there are underlying medical conditions.
Okay.
The symptoms can include
Yeah.
intense muscle aches,
Mm-hmm.
nausea,
Yeah.
vomiting, chills, sweating,
Okay.
anxiety,
Uh-huh.
and incredibly strong craving.
It sounds absolutely brutal. It's no wonder people find it so hard
Right.
to quit opioids on their own.
It is incredibly difficult.
Yeah.
And that's precisely why
Okay.
medical detox is so valuable.
Okay.
It provides a safe and supportive environment
Right.
to manage those symptoms,
Mm-hmm.
minimize discomfort,
Okay.
and reduce the risk of relapse.
Right.
You're not alone in this fight.
Yeah.
You have a team of experts
Yeah.
and a whole array of resources at your disposal to
So-
help you through it.
It's like having a safety net
Right.
and a support system all rolled into one.
Precisely.
Yeah.
And it's not just about
Right.
getting through the withdrawal process. It's about setting the stage
Right.
for long-term recovery.
Now I know that medical detox isn't the only option out there.
Right.
The article also mentions alternatives,
It does.
like quitting cold turkey,
Yeah.
outpatient programs,
Right.
and holistic methods. Let's explore those a bit.
Okay.
What are your thoughts on quitting cold turkey?
I'll be honest.
Okay.
Quitting cold turkey,
Yeah.
especially for substances like alcohol and benzodiazepines,
Mhm.
can be extremely dangerous.
Oh.
The withdrawal symptoms can be incredibly severe.
Yeah.
And as we've discussed, potentially life-threatening.
Right.
It's just not worth the risk.
So even though it might seem like the most straightforward approach,
Yeah,
it's often the riskiest.
absolutely. I
Well-
wouldn't recommend it.
Well,
Unless it's done under close medical supervision.
okay.
Outpatient programs, on the other hand,
Okay.
can be a good option for some people. They allow you to live at home and attend treatment sessions during the day,
Right.
which provides more flexibility.
So it's like a
Yeah.
less intensive level of care
Right.
than inpatient medical detox.
Right.
That-
And that can be a good fit
Okay.
for individuals with milder addictions or
Yeah.
strong support systems at home.
Right.
But it's important to remember that outpatient programs don't offer the same level
Right.
of 247 medical supervision
Right.
as an inpatient setting.
So they might not be suitable for everyone.
Exactly,
Okay.
especially for someone with a severe addiction or a history of
Yeah.
complicated withdrawals.
Okay.
That constant medical support can be crucial.
That makes sense. And what about
Yeah.
holistic detox methods?
Okay.
The article mentions things like
Mm-hmm.
dietary changes,
Yeah.
exercise,
Right.
herbal supplements,
Mhm.
and mindfulness practices.
Right.
What's your take on those?
I think they can be valuable tools
Yeah.
for supporting overall health and well-being,
Okay.
but it's important to
Yeah.
be realistic about their limitations. They're not typically a substitute
Okay.
for medical detox,
Right.
especially for someone with a severe addiction.
So it's not about choosing
Yeah.
one or the other.
Yeah, right. I see them as complementary approaches.
Okay.
Holistic methods can work really well
Yeah.
in conjunction with professional treatment,
Right.
but it's important to approach them
Okay.
with a balanced perspective.
So the key takeaway here is that
Right.
it's always best to consult with a healthcare professional
Yes.
to determine the safest and most effective
Absolutely.
detox approach for your individual needs.
Absolutely.
Right.
They can assess your situation, recommend the appropriate level of care,
Yeah.
and provide guidance and support
Okay.
through the entire process. You
Right.
don't have to navigate this alone.
That's such an important message.
Yeah.
There's no shame in asking for help.
No.
In fact, it's often the
Right.
strongest and smartest thing you can do.
I couldn't agree more.
So it sounds like medical detox is really about
Yeah.
giving people the best possible shot
Uh-huh.
at
Yeah.
starting their recovery journey.
Right. Safely and effectively.
That's a great way to put it.
Right.
It's like creating a solid foundation
Okay.
for everything that comes next.
The article also touches on
Yeah.
something I think is really important.
Yeah.
The stigma
Okay.
that often surrounds medical detox
Yeah.
and addiction in general.
Right.
It even asks the question,
Mm.
if medical detox is so crucial,
Yeah.
why is it
Yeah.
sometimes viewed
Yeah.
so negatively?
It's a great question.
Right.
And I think it gets at some
Yeah.
deeply ingrained societal perceptions.
Okay.
Unfortunately, we still live in a world
Yeah.
where addiction is often seen as
Yeah.
a personal failing
Okay.
rather than a medical condition.
It's like people think you should just be able to snap out of it.
Exactly.
Right.
And that couldn't be further from the truth.
Right.
Addiction is
Yeah.
a complex disease,
Right.
often with biological,
Right.
psychological, and
Okay.
social components.
It's not something people choose.
Right.
And it's certainly not a sign of weakness.
But that misconception can make people hesitant
It can.
to seek help. Right.
Absolutely.
Yeah.
They might feel ashamed or embarrassed,
Right.
worried about what others will think,
Yeah.
or afraid of being judged.
Right.
That stigma can be a huge barrier
Yeah.
to getting the treatment they need.
So how do we break down that stigma? What needs to change?
I think it starts with education.
Okay.
We need to help people understand that addiction is a medical condition,
Okay.
just like diabetes or heart disease.
Right.
It's not a moral failing,
Right.
and it's treatable.
It's about shifting that whole narrative.
Yeah. We need to move away from blame and shame and
Yeah.
towards
Yeah.
compassion and understanding.
Right.
The more we talk openly and honestly about addiction,
Uh-huh.
the more we can normalize it
Okay.
and chip away at that stigma.
And that includes talking about medical detox
Yeah.
as like
Yeah.
a legitimate and often essential part of the recovery process.
Absolutely.
Okay.
Medical detox is not a sign of weakness.
Right.
It's a sign of strength.
Okay.
It's about taking that first brave step
Okay.
towards reclaiming your health and well-being.
It's about seeking out the support and resources
Yeah.
that can help you through a really challenging time.
Exactly. It's about giving yourself
Okay.
the best possible chance
Right.
of success in your recovery.
Well, I think we've covered a lot of ground today
I agree.
and gained a much deeper understanding of what medical detox really entails,
Right.
why it's so important,
Uh-huh.
and what someone might actually experience
Right.
during the process.
It's been a fascinating exploration,
It has.
and I hope our conversation has been helpful for anyone who's been curious about medical detox, either for themselves
Right.
or for someone they care about.
And remember, if you are struggling with substance use,
Yeah,
there is hope
there is.
and there is help available.
Absolutely.
Reaching out for support is the first step
Yeah.
towards a brighter future.
You are not alone in this journey.
Yeah.
There are countless others who have walked this path before you
Right.
and found lasting recovery.
Thank you for joining us on this journey
Thank you.
of understanding medical detox.
Mm-hmm.
We hope you've learned something valuable today,
Yeah.
and we encourage you
Mm-hmm.
to continue exploring this important topic.
Until next time,
Right.
stay curious
Yeah.
and keep learning.